Hi, and welcome to our show. My name is Dr. Kat Kesty, and this is Dr. Chelsea Kesty, and we're double board certified dermatologists. Today, we're going to be talking about how to treat sun damage and precancers with lasers. So let's dive right in. Dr. Kesty, what does sun damage actually mean at the skin level?
It's a good question. What it actually means is that long-term exposure to UV rays damage things that are in the skin, like collagen, elastin, and makes actually DNA damage at the cellular level. What does that look like clinically? Clinically, that exposes itself as wrinkles, fine lines, collagen loss, or volume loss over time. What we usually say is the signs of aging.
And one thing that I think is interesting about sun damage, which may be a misconception, is that you don't have to be someone that goes to the beach every Saturday and Sunday and spends 8 hours on the beach. You don't have to be, a sun worshiper, a sun tanner, use tanning beds to see the effects of sun on your skin. Even that 2 to 3 minutes that we get every day walking to our car, walking to go get lunch, picking our kids up, that really adds up over time to show the sun damage on our skin.
Yeah, and data supports that, accumulation, which is the whole thing about aging, it's all cumulative. So when you wake up and you're 55 and you're like, oh my goodness, I look aged, that's not from the sun exposure that you had, yesterday when you went to the beach. That's from the time that you were 2 years old to the time that you're 55, an accumulation of all that DNA damage, the collagen loss, all that time that it takes to accumulate that. And that's what shows as far as aging.
So it's not all doom and gloom, right? So we have lasers that can actually reverse the sun damage that's been done to the skin, both the clinical signs and the DNA damage. So tell me, Dr. Kesty, where do you start? Explain to us lasers for sun damage.
So, the basic thing is that you're going to actually take away that damaged collagen or stimulate your body to clear that damaged collagen and replace it with new collagen. At the basics, that's what lasers are doing, even if they're non-ablative or ablative or any kind of technical term that you want to do. But that's what they're actually doing, is having your body or physically clearing that collagen that's damaged and having your body replace it with new, fresh collagen. And that's kind of what you look for as far as like your results over time.
So the collagen and other structures have been damaged by years and years and years and years of minimal or maximal sun. And so you use lasers in a controlled manner to do controlled damage, and then the body reproduces that collagen, but it's younger and healthier because it's new.
Yeah, exactly.
Are the different types of sun damage, like brown spots, red spots, collagen, fine lines, wrinkles, are those treated by different lasers?
Yeah, definitely. So, the clinical signs of sun damage or accumulation of sun damage, those vary between patients. So, some people get broken blood vessels or telangiectasia. So, that would be addressed by a vascular laser. Brown spots or freckles, those are sunspots. Those are going to be addressed by a brown spot laser, usually BBL, or a spot erbium ablative laser. Those are the two lasers that I like to do for that. And then for fine lines, wrinkles, that kind of stimulation requires a non-ablative or ablative laser. So that comes in different varieties like a CO2 or erbium or fractional, something where you're actually damaging the collagen in a controlled way to then have your body make new collagen.
So it sounds like the sun causes a lot of different symptoms on the skin. And each of those symptoms, red spots, brown spots, fine lines, texture, has a particular laser or set of lasers that's really, really good at treating that one part. So you can't get one laser and reverse all sun damage. You have to have a kind of variety of lasers.
Because sun damage looks different in me than it does in you, than it does in any other person. Yes, there's some themes that we can kind of talk about, like telangiectasias or vascular or whatever the case may be, but it does look different in each person.
Yeah, that makes a lot of sense because if you look at, your three best friends that may be the same age as you, one may have more of their background redness, one may have more wrinkles, one may have, more fine lines or, a lot of seborrheic keratoses. So, I guess it makes sense that everyone ages a little bit differently. So,
Yeah, exactly.
so you mentioned fractional lasers, and my question is, why are those especially popular? Our fractionated 1550, 2940, or CO2. Why are those especially popular for sun damaged skin?
I mean, we have a lot of data to support that fractionated lasers help clear the collagen effectively, clear that the signs of sun damage at the, histological level where we take a punch biopsy of skin not treated with a laser and then a punch biopsy treated with a fractional laser, and you can tell the difference in the collagen. The benefit of it being fractional is that it's a fraction of the skin that gets treated, meaning it's a fraction of the collagen stimulation, but it's a fraction of the downtime. It's a fraction of what we're doing as far as that.
Mhm. So you can still get really great results, treat the sun damage, but maybe with less downtime than if you did a fully ablative laser.
Yeah, exactly.
So when you're talking to patients about sunscreen and sun habits, can we use laser as a replacement for sunscreen, or do you still recommend your patients to use sunscreen every day?
I mean, it's all about the what is going to happen, right? So it's all accumulation of damage. So if you're 30 or 40, okay, you still need to use sunscreen because you're still going to accumulate a lot of sun damage over the next 40 years. Let's say if you're 110, okay, sure, you can skip on the sunscreen, but below that age, you're still going to have some accumulation of the sun damage. So you are going to need to do sunscreen and sun protection. So in short, no, lasers are not a replacement for sunscreen or sun protection or good sun habits, but it's the only thing that we can say actually reverses what you have, which is a really key thing because a lot of, skincare, even like tretinoin, some things that are helping to kind of actually, stimulate that collagen or give you that youthful look, they are not taking away that damaged collagen. So that's the only thing that lasers are going to be able to do is then that's kind of where they shine.
Yeah, I completely agree with you. I definitely have patients that don't use sunscreen for whatever reason, but I still recommend, swiping on 10 seconds of sunscreen in the morning. And I definitely agree that lasers are our best option right now to actually reverse that DNA damage, which I think is really wild if you think about it. Like, we have this amazing technology with 2 to 3 days downtime, or, 1 day downtime if you want, where we can actually take that DNA and lengthen the telomere, which makes it younger, and also actually reverse the DNA damage that's been done. I mean, that's just amazing, isn't it? That we can, look at, like you said, the biopsy studies and actually make your DNA look younger and less sun damage, which, has a bunch of benefits, both cosmetically and medically.
Yeah. And for the crowd, tell us what telomeres.
So telomeres sit on the ends of your DNA, and as we age, they get smaller. So if you look at the telomeres on a 60-year-old versus a baby, the baby's going to have longer telomeres. And there are supplements that you can take, kind of if you look at the anti-aging literature, to lengthen your telomeres in other organs. But on the skin, this is, the only thing that we have data is the lasers, which actually lengthen the telomere, which is just really amazing that we have this technology for patients now. So.
Yeah. No, it's awesome.
So, Dr. Kesty, I'm a patient. I have sun damage, 99.9% of the population. I know I want to get lasers to treat the sun damage. Where do I start? Because I can't buy a laser, myself as a consumer. Where do I start?
I mean, finding a board certified dermatologist or somebody who is very experienced in lasers is going to be the most helpful.
Mhm.
And hopefully, they have different lasers in their clinic to address all of the signs of sun damage, like we've talked about. So, what I would look for is somebody who has something to address the red spots. So, something like a vascular laser would be really helpful. Something that'll address the brown spots, something like a BBL or an ablative erbium, something like that. That's really helpful too. And then the third thing is going to be the powerhouse of all resurfacing. So something that is going to be a fractionated technology, but it is going to be helpful for that collagen stimulation. So something like an erbium, a CO2, a fraxel. Now that all depends on kind of what your skin tone is, what your downtime is, and all those, nuances. But those would be the kind of three things that I would look for as far as what you're looking for as a patient.
So, it sounds like if someone's looking for someone to reverse sun damage, you need someone that has a lot of lasers in their practice and that does a lot of lasers kind of clinically, which, if you call the receptionist, they should be able to answer those two questions. How many lasers do they have in the practice that they have access to on a daily basis? And how many laser procedures have they done? What percentage of their clinical time do they spend doing lasers? So it should be over 50%, I think. Yeah. So
It's definitely, it's part of our consultation. When we talk to somebody, we do a full like skin analysis. We're looking at how much background redness they have, how much, brown spots. Because even if a patient doesn't come to us and say, oh, look at this broken blood vessel, that whole part of it is a big analysis when we take the time to address all of the concerns of sun damage. Because what the patient is seeing is, oh, I'm aging, but they may not be able to identify what is actually aging them.
And that's kind of the art of lasers, right? Is, they may come in asking for brown spots or fine lines or wrinkles, and it's our job to educate them on, yes, you have fine lines and brown spots and wrinkles, but, in order to treat you more holistically and give you the best result possible in 6 to 12 months, we are going to be doing this combination of lasers to get you to your goal that you want.
Yeah, let's talk about that. What are the results 6 to 12 months from now?
So full collagen stimulation, I say it's 6 to 12 months after any laser. I do think that you continue to improve, just, being in practice for a long time now. My patients that got one laser 5 years ago, I'll see them 2.5 years later and they're still improving. It's really amazing the longevity of the laser results.
What's your like breakdown as far as what you've seen? Like,
For laser resurfacing patients, I would say 2 weeks you're healing. At 1 month you're healed. At 28 days, your skin has had that one full turnover. And depending on how many wrinkles you have, you may see a really significant result then. But usually I say 6 months, you're at about 90% of results. So it's a slow process, because we're not injecting collagen into your skin. We are politely asking your body, hey, can you ramp up production of collagen? Can you heal? But definitely not like 2 weeks or a month. Like during that month, don't even look at your before and after, as I tell patients, because you're healing, you're just barely healed at 28 days. So, and that's a fractional laser. When you talk about fully ablative lasers, you're healing for 6 months after a fully ablative laser. So we're talking about results at about a year. So, well, thank you so much for listening to our episode on treating sun damage with lasers. If you have any questions, please let us know.